USMLE, Step 1. Year 2024, number 0629. A 57-year-old female obese patient has type E, noninsulindependent, diabetes mellitus of 15 years. Duration. Because her hyperglycemia is not well controlled with diet and oral hypoglycemic agents, she self-administers insulin by injection. She comes to her physician's office with a fever and a draining external ear infection. Pseudomonas aeruginosa is cultured from the drainage fluid. Which of the following insulin regimens most closely mimics insulin release from a normally functioning pancreas? A. Post-meal injection of lente insulin plus a pre-breakfast injection of regular insulin. B. Premeal injections of NPH insulin plus an injection of insulin lispro at bedtime. C. Pre-breakfast and predinner injections of lente insulin plus an injection of regular insulin if blood glucose, measured by fingerstick, exceeds 150 mg per deciliter. D. Premeal injections of insulin lispro plus morning and evening injections of detemir insulin. E. Post-meal injections of insulin glargine. Insulin regimes. Bolus insulin manages blood sugar spikes that occur with meals. Basal insulin provides a constant level of insulin throughout the day and night. Examples of insulin medications. Insulin lispro, a rapid-acting insulin, starting to work within 15 minutes and lasting for 4 to 5 hours. It's used before meals to manage blood sugar spikes. Regular insulin, a short-acting insulin that begins to work within 30 minutes and lasts for 5 to 8 hours. It's often used before meals to control blood sugar spikes. Neutral protamine hagedorn, NPH, insulin. Isophane insulin, an intermediate-acting insulin, starting to work in 1 to 2 hours and lasting 16 to 24 hours, providing a basal level of insulin. Lente insulin, an intermediate-acting insulin, taking effect within 1 to 3 hours and lasting up to 24 hours, providing basal glucose control. Insulin detemir, a long-acting insulin that can last up to 24 hours but often requires twice daily dosing for full effect. Insulin glargine, a long-acting basal insulin that provides a steady level of insulin, typically for about 24 hours, with no peak, providing basal glucose control. Diabetic foot infections are commonly associated with antibiotic overuse. Pseudomonas aeruginosa is one of the most common gram-negative bacteria found in diabetic wounds. The answer is D. Premeal injections of insulin lispro plus morning and evening injections of detemir insulin.